Welcome, Mountain Mamas, to our first aid training on abdominal injuries. Now, for abdominal injuries, they come in two different types. We have blunt trauma, which is something impacting our bodies. And then you have a penetrating trauma, which is something has gone through or into our abdominal area. So those are kind of your two areas. And the tricky thing is the abdominal injuries are so difficult because there's not a lot of other parts of the body. Whereas if there's an injury here, you really can't see if there's massive bleeding happening in there. It's just hard to tell. Like you might feel tightness that feels more tight than normal. You might see some bruising or discoloration. Of course, they're going to be having pain, but you know, without taking them to a hospital and doing all the imaging and stuff like that, there's really not much more that you'll be able to tell if it's internal. So abdominal injuries are really tricky in that department. So some of the signs and symptoms of abdominal injuries, first one is obviously if there's something impaled into them, you know, we have an obvious injury. There's a laceration, like, you know, guts are coming out, you know, things that are pretty obvious. That's, you know, obviously a sign that you have abdominal injury. Another sign is if, you know, something happened, they fell, maybe you were coming on a car accident, things like that. You don't really know what happened, but things could have happened that could have really injured the abdomen area, and they start going into shock. Like you may not see other symptoms, other signs of things going on in their body. They look normal, but they're starting to get cool and clammy. They're starting to become more confused. Their heart rate starts going up really high, but is weak because their body's trying to compensate for the. I mean, imagine someone is like bleeding everywhere inside. What's the body going to want to do to kind of compensate for that? So you're going to get less blood flow everywhere. So you're going to become a little lightheaded. You're not going to be you're going to be more confused. Your skin's going to become cool and clammy. Your heart rate's going to race because it's trying to keep up and with that blood flow and keeping your trying to keep your blood pressure high enough. And then your respirations, your body's trying to get enough oxygen, but it's not because it doesn't have that oxygen in the blood. So your respirations get more rapid, but more shallow at the same time. So all those signs, if you come upon someone and they just look like they're in shock and you have no idea what the mechanism is of injury, what caused them to be in that, then you just treat for shock right there. So the way we treat for shock is we put them on their back. If that's a comfortable position for them, lift up their legs, keep them warm and keep them calm. That's basic shock treatment. So nothing too complicated. All right, so our first sign is that there's an obvious injury. Second sign is that they start going into shock. Third sign is if they have blood coming out of any orifice. So because you've got blood in here that's trying to get out. And if it doesn't have an open wound, then then it's coming out some way. So they're throwing up blood. Vomiting blood looks like coffee grounds because if it's been partially digested. So the idea is that if it's bright red blood, it's likely an injury that's happening in the upper GI system, throat to stomach area. But if they're throwing up things that are like black and coffee grounds, it means it's been more digested with the acids and stuff in your body. So it's a lower down in the abdominal area wound, if that makes sense a little bit. So you're vomiting up coffee grounds. And then on the stool and our stool, if we have blood in our stool, especially a lot of it, your stool's going to go black and they're going to be tarry. They could be even sticky kind of if it's really bad. A point to note is if someone's taking iron, it does the same thing to their stool. It doesn't make it a tarry, but it'll make it a black color. So that's a good question to ask somebody. And then also urinating, if they've got blood in their urine, it's going to just be a reddish pinkish color. So those three, if you're noticing that, if it's been a little bit and you're noticing that's a symptom that you could have some abdominal bleeding inside. And then if they're having abdominal pain that's lasting longer than 12 to 24 hours. So you're on an overnight camping trip, someone's complaining abdominal pain and it's not going away, and it's been 12 hours, maybe especially if it's getting worse and there's other symptoms, nausea and things like that, then that's something else we want to be concerned about. And then a localized abdominal pain, if they can go, it hurts right here, or it hurts right here. That means there's different quadrants in our body or in our abdomen. And if you have pain in any of these sections, that means it could be abdominal injury is in a different organ. So my husband correct me if I'm wrong on this one. But let's see, he does ultrasound. So right upper quadrant is stomach, liver,
Wait, you're
Okay.
talking about just
abdominal pain.
where things can bleed?
Yeah,
Yeah, can I do it?
yeah. We love guest
I wasn't
lecturers.
listening to the last section, but
And the four quadrants, if you have pain, yes.
okay, so this one, right upper quadrant, I'm in mirror image, so right upper quadrant. That's a very popular one that I get a lot of ultrasounds for. Here's the 5 F's. This is gonna sound maybe a little embarrassing, but 40, fat, flatulent, fertile, or I can't remember the other one, but female. Those are the problems with cholecystitis, and that's where your gallbladder starts to infect itself, or you get stones in it. So anyway, right upper quadrant pain, especially after eating, that's one that you can get. That's kind of more of a chronic pain, like not something that's going to happen like while you're hiking and it's just something that your body does. So left upper quadrant pain, I mean, your colon goes up like this across there. It could be something with your colon. It could be your spleen is way back here. Your kidney is way over here, your left kidney. So it could be something like that. But most of the time it's like intestinal pain, And then lower right quadrant, right down here, that's possibly an appendix pain or, intestinal, something like that. But a lot of times we'll look, and right here for women, especially with mountain mamas, you could have obviously pelvic pain, like an ovarian cyst right here or right here. And so right here, ovarian cyst, or right here, like an appendix pain. So if you have any of those pains that are really acute, you want to make sure that you take care of that, because it could be like an ovarian cyst that's ruptured or this causing pain, or an appendicitis right here. That could be very extremely dangerous if you have something like that. Then over here, this is pretty less common, the left lower quadrant, but most of the time with women, it's like an ovarian problem right here. So anyway, and I mean, your intestines go like this, like that. So it could be an intestinal problem as well too.
I've had people have, like, if they have really bad constipation, if they're on a trip and they haven't pooped for days, that left lower quadrant can also be some severe impaction from a stool. Yeah.
Hey.
How's that for guest? Like, that was perfect, not planned. Okay, excellent. Now I've lost all my notes. Here we go. Okay, fantastic. So also, if you're noticing with that abdominal pain, if they're and if you touch it, do a little soft palpation here, feel each of those quadrants. If they're like, they flinch and it's a localized area, that gives you a clue as to if you might have pain in one of these areas. You're also feeling for rigidity. If you're like, oh my gosh, it is super tight here. And they're like, I haven't been doing 500 crunches. So that could be something that's concerning. You might have bleeding that's causing pressure under there. And then if you're feeling palpable, you do this and do like palpable lumps, feeling lumps in there. That's also not good. And then distension, you've got a distended abdomen or asymmetry, like your abdomen doesn't match. Those are all signs that you've got stuff screwed up in there and they need some help right away. So we talked about the treatment for shock. The other the tricky with treatment for abdominal injuries is unless it's an open wound, there's not much you can do for it. We can just say, oh my gosh, you could be hemorrhaging in there. We can't, there's nothing you can't really apply pressure. It's just a tricky thing. So you're going to want to get that person if you're seeing any of these symptoms, and especially if you know that there was some sort of mechanism injury, like they fell, something hit them in the abdominal area, things like that, then we definitely want to make sure we get them out and evacuate them as quick as possible. If they're able to ambulate, but I would say if you're able to do like a carry, because you're just thinking whatever's going on there, the more they move, it could, make things a little bit worse. So we want to get them out as fast as possible and carry them if we can. If there's an open wound, these are the fun ones. Okay, so say like something happened, fall, there's a million other things, car accident, things like that. And you have an injury with, let's see, I'm going to get too far ahead of myself. I want to say on abdominal treatments, we want to keep them in a comfortable position. We talked about a shock position with their legs up and their body down. If they're comfortable in that position, that's great. If you have to move them any other way, then definitely do that. If whatever is going to be most comfortable for them. Make sure they don't have anything by mouth, because we're going to try to get them to a hospital and they likely will need surgery. So we want to keep them with no food or water. Technically, if it's going to be a long evacuation, 12 hours or something like that, then we want to give them some water, just little bits at a time so they can handle it. If there's external bleeding and it's just something that we can see, we want to control that bleeding by pressure. We're going to put on bandages and gauze, and then just apply more pressure until we feel like that is controlled as best as we can do. And then of course, evacuate. Now, evisceration. This is that really gross stuff when like there's an abdominal injury. And what do we have mostly in this area? Guts. Then the guts come out and it's super gross and looking. And so I'm going to have my husband, do you want to do it?
Yes.
I'm sorry, Milana, we don't know where she is in the house right now. So we're going to have my husband instead of my daughter be our patient. I'm going to see if we can get this. So likely if you've been had evisceration in your abdominal area, we're going to get you in a laying down position. So I'm going to have him just lay down. We're just gonna, he doesn't have to expose his belly. We're just gonna kind of keep this, G-rated. So, and our great first aid kits, I want to use these first aid kits so you guys kind of see what's inside your Mountain Mama kits. So we're gonna open this up, and there's a section called bandaging here in the middle, bandaging, and then this one down here says bleeding. All right, so I'm gonna take some bandages. So what I would do in a real situation is we would open shirt, pants, whatever we need to get to this area. So with guts, we want to make sure we keep them cool or moist. That's what they need, is being moist. And then we want to get them evacuated. So a way to moisten guts is we want to have get our gauze, rip them all up, and we're going to set them on top of his guts that are just kind of sitting here. All right. And we want to make sure these are moist. Now the way you add water to this gauze is we don't want to use just Camelback water, what you've been drinking out of. If you have a chance, if you have the time and someone happens to have a stove, boil water. And we want to make sure it's as sterile as we can get it. A disinfected water, if we have to use chlorine tablets and things like that, that's fine. But ideally, like that's the fastest way. Boil some water, use that, get our gauze in here, keep it clean, and then just set those there nice and stuff on top. And we want to make sure that this is done every 2 hours. You check the gauze to make sure it hasn't dried out. We want to add more and make sure it stays nice and moist as well. And then we want to cover this dressing with a thick, dry dressing. Some of my favorite dressings to use, we've got lots of 4x4 gauzes. That's what these are. What I really like are these things called ABD bandages, abdominal pads, sorry. And they come in different sizes. We just have like a 5x9 inch, but it unfolds and then it just kind of sets it on here, and it's less stick, and it's fantastic. So you can put a few of those. I would just use as many gauzes as you could, ABD bandages and things like that. So first we're gonna have a layer of moist bandages, and then we'll have a layer of dry bandages on top of that to kind of protect this area. And then we want to get them rapidly evacuated as fast as possible. Let's see, if this is the fun part, if a rapid evacuation is not possible, what you want to do is get your gloves. We have gloves, of course, we put our gloves on and all that sort of stuff for this. We want to, say they have an evisceration. We are stuck somewhere. We're not going to get out for 10 hours or something like that. This is going to be awful for him. So you could actually try and tease. You want to flush the intestines with some clean water and tease the intestines back in. So we would open up the wound a little bit, and that will actually kind of help pull, the intestines will actually kind of pull back in a little bit. And you might even have to kind of jiggle a little and kind of help get them in. If that doesn't work, then you might actually have to kind of slowly place them back in, being very gentle and things like that. Though I have to say, I've been in an abdominal surgery and they're not gentle. They just jam your guts back in. I'm just saying. So if you ever hurt after abdominal surgery, that's why. Anyway. But anyway, that's what you can do. And then you would, of course, clean and dress that wound as best as you could just like you would with regular wound care and things like that. So those are eviscerations. If you have an impaled object that's just sticking out of somebody in their abdominal area, we should not try and take it out. We should try and stabilize that. And you stabilize that with, we've got lots of things. We've got roll gauzes, bigger ones like that. put gauze around here, tape it down. Anyway, so you've got something that will support that object and try and keep it as immobile as possible. Probably even having someone be assigned while you're transporting them, especially to kind of keep that still. Because if you've got a sharp thing that's stabbing into somebody and you move, every time that move, it's going to be cutting up all sorts of stuff inside and causing more bleeding. So we want to keep it as stable as possible. So there you go. Those are your symptoms of your abdominal injuries with all my helpers today. Do you guys have any questions? Yes, we got questions. All right, we're good, babe. Thanks.
Hang on, yeah, I found it.
What if you don't have enough of the things that you put on the person's? Yeah,
If you don't have enough bandages, you're going to try and do the best thing you can. Ideally, that's why you want to have a lot of gauze and things like that in a first aid kit anytime you go on hikes, because you never know when you're going to have to use them. The nice thing is then they come in packages like this, they're considered semi-sterile. So that's, at least you know this is a clean. If you're in a rugged situation and you don't have anything, then what you're going to do is look around for the cleanest cloth item that you have, whether it's the shirt you're wearing or someone else is wearing, a change of clothes in your pack, you know, whatever's the cleanest clothing you can. And you're going to do the same thing. Get it moist with the most cleanest water that you can find. If you have a chance to boil that water, awesome. Use that water, boiled water. You can even put that cloth in the pot and boil it. That would help sterilize that cloth as well. If you have the time, you'd want to cool it down, of course, before you don't want to put a boiling hot item on someone's wounds. But, you know, that idea is that, yeah, you know, you can use the cleanest stuff you got. Good question.
Okay, you had a question?
So on the thing, if there's like something jabbed in, what if you pulled it out, would that be bad? Like if it was something really big, like sharp, like glass, what would really happen?
Yeah, the problem is if you pull something sharp out of inside of you, what you're doing is as you are pulling it out, you are causing more injuries. It's cutting all this other stuff inside that wasn't cut up before. So you don't want to take something out. You want to keep it stable, like it was a piece of glass got stuck in you. We want to put a bunch of cloth around it, some gauze, and tape it down so it just kind of provides this little protection around it, and so it doesn't move. And then we want to go to the hospital, and at the hospital, they're going to probably take him into surgery, take it out, and then stitch him up really fast before things start to bleed. So.
And then on the stuff where it's like not an open wound, it's just like you're hurting in one of the sections. What if that's like something else, if you're not hurt?
Yeah, it's a tricky thing. So these are injuries we're looking at if we're in the mountains. So if we're in the mountains and all of a sudden if you had something hit you in your belly area, there's an indication that probably it hurt something in there. If your belly still hurts, you know, if a tree or a rock hits you, you're like, it probably hurt something in there. And so I want to get to the doctor's office as fast as possible. If nothing happened to you and all of a sudden you have abdominal pain, it could be something like JD talked about, where you could have gallbladder, or your gallbladder could be all cranky. You could have stones. You could have, you can have all sorts of issues that are going on down here. You can have an appendix that is burst. So there's lots of things that could be going on still that are still serious enough you want to get to the doctor's office for.
Well, what if it's a tummy ache?
Yeah, tummy aches, that would be a pain that hopefully goes away in about an hour or two. So that if we have pain that lasts longer than 12 to 24 hours, we're really concerned, especially if we don't know what it is. Tummy aches and things, you can solve that by Tums medication. Simple foods like a brat diet, bananas, rice, applesauce, and toast. Any of those foods can be sent a lot more comfortable on your belly and help you hopefully not feel so sick.
So I know how you said like if you got like a fake cut and like the guts were coming out, and if you were like nowhere close, I heard how like you try to like put them back in, but what if it's like just pain there and you didn't get cut, like if the rock hit you? What would you do if you weren't close to a doctor's office? If you're like in the middle of like the top of a mountain?
Yeah, what you do is try and evacuate, keep that area as immobile as possible and then evacuate them. Yeah. So if we don't know what's going on, we just want to get you to the doctor's office as fast as possible. Yeah.
I think.
What if no one's there?
then you're gonna just have to try and get to the hospital by yourself. That's why a lot of times we recommend, that's why we always recommend hiking with a buddy and then having a cell phone with you and an emergency beacon. So you can call for help if you need to get out of somewhere that you can't get out yourself. Good questions. Mhm.
Thank you.
All right.
Come back.
Well, thank you guys so much for all your help. And thank you for my guest presenters today. Have a wonderful evening. And we're so glad to have you guys here on our training today.